June is Men's Health Month, so Covenant Health is partnering with local first responders to raise awareness and make sure men get the care they need. 6 News reporter Jack Ziskin is on your side tonight with one healthcare provider who survived a scare of his own. Jack.
Bo, Charlie Elliott is a critical care paramedic with the Oak Ridge Fire Department and a part-time flight paramedic for Covenant Health Air. Elliott thought he was healthy, but then he had a heart attack in February of 2025. He says he's lucky to be alive.
I experienced a STEMI heart attack, and that is one of the ones that only come with a 12% chance of survival.
Just a day before his heart attack, Elliott felt a pain in his arm. He thought he pulled a muscle.
I did focus on fitness, worked out, boxing, things like that. And then I just really probably didn't take care of the inside as much. And so now I really focus on that.
The pain in his arm caught him off guard.
It was kind of like inside and outside. And so it would feel like it was numb with more like bugs type crawling on it. And it was just different from what people have told me that they experienced during a heart attack.
Many men are putting themselves at greater risk of having a heart attack.
We know that about 40% of young men aged 20 to 50 don't have a primary care. And really, when we think about cardiovascular screening, the best thing that any male can do is to be established with a primary care physician.
Dr. Jeremy Brooks says cases like Elliott's aren't uncommon. They can be a symptom of poor heart health.
Sometimes we have patients that come in and they just say, 6 months ago I could do this 90-minute workout, I didn't have any issues. Now I get to 30 or 45 minutes and I just can't go any further.
Going to the doctor can be the first step towards preventing your heart problems from getting worse for you and your family. Elliott says putting his health first is part of being a father.
Most men like to be the provider, take care of their family and not take care of themselves. So I would say put yourself first, get that annual check, get those screenings, do the cardiac scans.
When he had a heart attack, his youngest daughter was the only one with him, and he knew there was nothing she could do to help except one thing.
I said, just say a prayer, that's all, that's it. And so she did while we sat in the parking lot at the back of the Waffle House and said a prayer, and the ambulance freed up at the hospital and they made it.
Now, Elliott has since made a full recovery and is thankful to the staff at Covenant Health who helped him get better. He is urging other men to take care of their health and their families moving forward. Bo.